Hello everyone. So this is Dr Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics. And this is another question MCQ that we'll be discussing in the MCQ series of basic sciences for general orthopedics. Well, we have the first question in front of us, that increase in the callus formation or cartilage formation is seen. A, rigid immobilization. B, necrosis of both the ends. C, increased mobilization. D, compression plating. Uh, Even if I don't have any sense of this question right now, I don't know any answer, but A and D are more or less similar. Compression plating will lead to rigid immobilization, and necrosis and increased mobilization. I mean, let's take a look. See, when we talk about bone healing, when we talk about fracture healing, it is of two types: primary, secondary. First of all, let's talk about the secondary healing. It is also called as the indirect healing. This is the usual method of fracture healing. I'll give you just an example. So there's a fracture. When that fracture happens, it has to undergo a series of steps in the fracture healing given by Frost. We'll come to them. And the first step is fracture hematoma formation, which usually happens within a week of the fracture. Now think about it, that if you open the fracture, you're treating the fracture for the good of it, for the treatment of it, for fixing it with a plate. You open the fracture, you cut the skin, the muscle, the tissue, the fascia, and then you open the fracture. So when you open the fracture in front of your own eyes, don't you think that you will not let hematoma be made over there? Yes. So technically, whenever you are dealing with a fracture where you're opening a fracture in front of your eyes and you're kind of putting a plate on it, you will not allow the hematoma to be made. So the biological steps won't be followed. And when the biological steps won't be followed, that will be called as the primary healing or the direct healing. So whatever we have here is the secondary healing or indirect healing. So technically this happens when you preserve hematoma. Plaster is a classical example. There's a fracture. Over that, there's a skin. Over that, you apply a plaster. So you have reduced a bone, you have reduced a fracture, and then you have applied a plaster. Technically, you have not touched the hematoma. So you have preserved the hematoma. So biology is preserved. So technically, biology is helping you. Biology is the actual healer, primary healer, main healer, direct healer. You, as an orthopedic surgeon, are the secondary healer, the indirect healer. That is what they've shown here. So indirect healing is the usual method of fracture healing, which is the secondary healing, and POP is a classical example. Now, the fracture healing has two explanations. One is called as the Hunter staging. The second one is the Frost staging. First of all, Hunter staging, there are three basic stages: stage of impact, second stage of induction, third stage of inflammation. So first of stage of impact, simple fracture, that's all, impact. Stage of induction, the cells over there, the pluripotent cells over there, they will start leading to healing of a bone, resulting in the formation of a callus. The third stage, inflammation, and we all know what inflammation means. That is cellular proliferation and neovascularization. Apart from Hunter staging, we have a Frost staging, where we technically have 5 steps. Number one, hematoma formation. Number two, inflammation, what they call as granulation tissue, and basically it is inflammation. Then we have the stage of soft callus, hard callus, followed by remodeling, followed by modeling. As I said, now I talk about direct healing. So I told you, in indirect healing, secondary healing, you are the secondary healer. Orthopedic surgeon is the secondary healer. Biology takes the driver's seat. Biology heals it. The previous stages that I've shown you, that I've taught you, they heal it. Direct healer, we heal it. How we heal it? Primary healing. Direct healing. Healing by primary intention. What does that mean? You have opened a fracture. The fracture is in front of you. The hematoma is gone, because see, when you are operating a fracture, you will definitely put some suction over there. Some assistant will do suction. And when suction will happen, next day of the fracture you are operating it, suction will happen, the blood will be drained. There will be no blood. How will it make any hematoma? So no hematoma, no inflammation, no chondrogenesis, no soft callus, no hard callus, no remodeling, no modeling. So all the biological steps will be bypassed because I am the direct healer. I told biology, I said, biology, relax, I'm healing it. Because I've opened the fracture in front of my own eyes and I'm doing rigid immobilization with the help of a compression plating. Are you able to understand? I will not allow any hematoma. I will not allow any callus formation. I am the direct healer. I am the primary healer. I am the osteoanal healer. And I will do compression plating after anatomical reduction and I will fix it. So usually open procedures wherever you are putting a plate or a screw. So there you have direct healing. Now, In this direct healing, there's a very beautiful concept called cutting cone mechanism. What do you mean by cutting cone mechanism? When you are doing an anatomical reduction of the fracture and then you put a plate. So what happens, from one part of the fracture, there's a cell called osteoclast that jumps over to the other part of the fracture, that jumps onto the other side of the fracture. And osteoclast has to cut a cone. It has to resorb the bone. So it cuts a bone, it resorbs a bone. Who follows it? Osteoblast, and that leads to deposition of the bone over there. So osteoclast काटता जाएगा, osteoblast उसकी जगह पे बनाता जाएगा. So that is what is called as cutting bone mechanism, which is a classical component of the direct healing. Now, if you see this question or if you see this image, then they are trying to show you that somebody is putting up a implant and where they have opened the fracture. So you expect a primary healing. You don't expect a secondary healing. Nailing. You expect a secondary healing. Why? You are not opening the fracture. मेरा बात समझ आ रहा है? You are not opening the fracture. You have the fracture here. You are not opening it. You're just putting a nail. The nail is crossing it, but it is not disturbing the biology. Okay, so nailing, POP, secondary healing. Plating, compression plating, primary healing. Come back to the question. Increase in the callus formation. Now, callus is what? Primary healing, secondary healing. Secondary healing. So rigid immobilization, option A, I repeat A, option A, rigid immobilization will give you primary healing. Necrosis of the bone, it is a part of primary healing. Compression plating is a part of primary healing. Callus you will see in secondary healing. When you are increasing the mobilization, when you allow some micro movement at the fracture site. Micro movement at fracture site is an amazing concept. If you allow some micro movement at the fracture site, that promotes an environment of more callus formation. So answer is C. I think you got the concept right. So this is one question from general orthopedics, which I wanted to take so as to give you an idea about the two types of bone healing, fracture healing. I wish you all the best. Stay tuned to the channel. Thank you.